Hello, Dr. Arya here. Welcome back to my YouTube channel. In this video, I want to share with you 6 common signs of depression and how you can overcome this with the B.E.A.T approach. Stay tuned. Hello and welcome back. Unfortunately, the stresses of life can have a negative impact on our health in total, particularly on our emotional well-being. Our ability to feel, to think, to act and behave can all be impacted negatively as a result of that, leading to even greater consequences in other aspects of our lives, such as the loss of a job, the inability to hold one, or the breakdown of a relationship, the feeling that we cannot cope, sometimes feeling like we want to give up, and the list goes on. The presentation of depression can be so varied and so broad, ranging from emotional, physical, behavior, cognitive symptoms. In this video, I just want to share with you 6 of the common symptoms that may suggest depression that you need to be aware of so that you can safeguard yourself from that. But also in this video, I'm going to share with you my B.E.A.T approach, which would help you to overcome depression. So the first symptom that may suggest depression is persistent low mood, is the feeling of sadness. But this is not just any sadness, it's feeling sad all the time, most of the time, most of the day, and for a period of time. Yeah? So you're feeling constantly sad for no specific reason. So they could throw you a party, and actually you could just be standing there and not just feel any emotion. So there's some form of numbness to your environment, numbness to everything that is going around you. You just don't feel happy. That inner joy, that inner happiness is just not there. And even externally, nothing really moves you when it comes to feeling happy. So persistent low mood or feeling of sadness all of the time, most of the days. The next symptom is the loss of pleasure in most activities. So maybe before you were, happy, chappy person, you were involved in various activities, even, if it's few activities, but it was something that you really enjoy doing. But now you cannot be bothered. You cannot even get up to, go to the bathroom. The things that used to give you joy, the activities that you used to be involved in that meant something to you has now lost that meaning. And you don't feel what's the point of doing those activities. So there's a loss of pleasure, a loss of excitement, a loss of joy in activities that before used to mean something to you, before you used to take joy in doing them. You no longer want to do those activities. The next symptom to be mindful of is a disturbed sleep. So this can present as oversleeping or undersleeping. Now, some people might be guilty of sleeping too much anyway. And some people, depending on their schedule, probably, don't sleep the recommended hours, which is 7 to 8 hours, okay? But when you notice a sudden change in the pattern of what is normal to you, and you find that you're sleeping more hours than usual, you're finding that you're waking up late, and actually you're running late to even work. But this is not just a one-off, which can happen to all of us, but it's happened consistently every day. So most of the time, so it's the persistence of the symptoms that is what makes it different, okay? So you're sleeping more and you're waking up late, or you're sleeping less, so you find yourself waking up in the night after just 2 hours, too many things on your mind, you just can't go back to sleep, you're struggling to sleep. The next symptom to be aware of is the loss of energy or fatigue. This can be physical as well as mental. So the inability to do anything because you just feel no energy to do anything. Alarm clock goes off and you just feel like you just want to sleep and sleep and sleep. You just don't have the energy to get up or to do anything. Everything just feels like a chore. It just feels so difficult to get through. It just feels so slow. And often you will just notice it also in the person's movement, even the way they move is just like, I just don't feel like, not only am I not feeling it, I just feel the inability physically as well to actually do it. So lack of energy or fatigue. The next symptom is poor concentration or the lack of focus. We all know the importance of the ability to be able to focus because it's so important in meeting targets, in being able to think clearly, in being able to make decisions. So this can be such a frustrating symptom for someone. And it can have so many negative consequences. You can imagine not being able to get through your daily tasks at home or even at work, not being able to keep up with the workload, not being able to make decisions which are important. And this frustration can lead to stress and even anxiety as a result of that. So poor concentration, the lack of focus, which can lead to the lack of clarity and so many more problems. The final symptom I want to share with you is suicidal thoughts or thoughts of self-harm. Unfortunately, depression can be so overwhelming for many, and it could result in people getting to a place where they feel so hopeless, so worthless that they feel life is no longer worth living. People might feel that no one cares for them, no one loves them, and that, they are basically a nuisance to the people, their loved ones around them. Of course, this is not true, but for the person going through depression at that time, it feels very real to them, and they might end up taking measures such as harming themselves physically through cutting, which they see as a form of relief to what they're feeling, or sometimes if support is not there or they don't get the right help, they might actually end up committing suicide, which is a very, very difficult place for anyone to be. And a lot of lives are affected, not just the person that is going through it, but of course also the family and everyone else that is related to that person. You may relate to some of the symptoms that I've shared so far, either because you've gone through it before or you're actually experiencing it now. What I want you to know is that you're not alone in this. Depression is very common, and some of the symptoms I've explained, all of us may have encountered it in different degrees in our life, or we would encounter them at some point in our lives. This is because, we're all working through life, and life itself is very challenging. Life itself is tough. We will have our ups, we will have our downs. What we have to make sure is that no matter what happens, whatever we're going through, we have to make sure that we prioritize our health, particularly our mental well-being. And we have to make sure that we do whatever is necessary to look after our happiness, to look after our joy, to be able to look after what is important to us that makes us happy. So I want to empower you with the next step of the video, which is the B.E.A.T approach, which is just a simple tool that if you can apply it to yourself, even on a daily basis, it would really help to support your mental well-being. I call this the B.E.A.T approach. B-E-A-A-T. B, be aware of your feelings. What makes you happy? What makes you sad? E, embrace and be honest with your feelings. Accept them as normal. A, assess what is the state of your emotions. What are the triggers? A, act. What are you willing to do to change the situation? Then finally, T, time. Give yourself time to get better. Now pause and just take a moment. I want you to process the information you have just received. How can you apply the B.E.A.T approach to your own life? How aware are you of your own emotions right now? Are you in a happy place? Are you sad? What does happiness feel to you? Because what makes you happy would definitely be different to what makes me happy. So just take a moment. How aware are you of your own emotional needs right now? Because that is so important. if we are aware of what we need, of what makes us happy, of what makes us emotionally fulfilled, then we're more likely to decipher when something else come along that doesn't make us happy. And then we're able to make the right decisions that will support our own well-being. Now that you begin to think about that, how have you been honest with your own emotions? Have you embraced where you are emotionally? If you've been feeling sad, have you just downplayed it? Have you said, I'm feeling fine, when actually on the inside you are screaming, I'm not? Can you not see that? How honest are you with your own feelings? Have you exalted other people's feelings above your own? Because sometimes we get very good with pretending that everything is fine. And we laugh and we look good, but actually on the inside we are bleeding. So just be honest with your own emotions. Right now, in this moment in your life, where are you emotionally? Now I want you to begin to just assess that on a scale of 1 to 10, with 1 being really not happy and 10 being like very happy. Where are you? Are you a 5? Are you a 6? And if you are 6, ask yourself, what can I do? Because that's not your optimum, isn't it? What can I do to really make me an 8 in the next 3 months in terms of my level of happiness or of joy, that soundness of mind? What do I need to do? So just make a quick assessment. If I'm not, my level of happiness is just 2 out of 10, what can I do to improve it? Why is that the case? Why am I not happy? What are the things that are going on around me that is depriving me of that joy, of that happiness, of that good, happy feeling mood? Now that you have done that quick assessment, what are you going to do to change your situation? Because you see, happiness is within. No one can make you happy. Now, as a doctor, I may be an expert, in the sciences, but you are the expert of your life. So you know where the shoe hurts. You know why the shoe is hurting. It means more to you. So you have to make a decision that this is the place I find myself, but what are you willing to do to change that to the desired emotions that you want to feel? Because sometimes we can get caught up trying to blame others. We can get caught up trying to feel helpless and feel even pity for ourselves, and get into that place where we feel, everybody or somebody else should do the work for us to make us feel better, but we are not ready to do the internal work, to be able to do the things that we need to do to pick ourselves up again. It is tough, I must say, but it cannot be escaped. So however you are feeling, whatever you're feeling right now in your life, what are you willing to do? What sacrifices are you willing to do? What price are you willing to do to get yourself into that place that you need to be emotionally? And that stems from a place of self-love. Do you love yourself enough to want to give yourself what it needs, what it deserves? Do you love yourself enough to give it the best? And I would say that, having optimum health, physically, emotionally, spiritually, whatever it is, that or whatever that means to you, is very important, because you are worth it. So now the next step is act. What are you willing to do? What actions or acts am I willing to do to make sure I get the results that I want when it comes to my emotional well-being? Now, some of us, we know what to do already. We just need to take the step and do it. Sometimes we might be able to do it by ourselves. Sometimes we might need the help of a professional. And this is very important because we cannot always do everything by ourselves. And there is no shame in reaching out for help. And I always celebrate my patients when they actually take that step and they come to see a doctor and say, you know what, something is just not right. I don't like the way I'm feeling, it's affecting my life, it's doing this, and I need help. And I actually say, that is the best step and the bravest step that you've taken, and you should congratulate yourself, because we all need help. We cannot get through life alone, and that transpires in every area of our lives. And this area of our lives, mental well-being, is no different. So if you need help, this is the time to seek help. And there's always, always, always help available. So never carry the burden on your own. So reach out, but be willing to do the work. Because people can help you. They can only help you so far. Even as a doctor, I can prescribe medications for you. But if you don't take the medication, it ain't gonna work. So, you can go and see a counselor, but even if the counselor, guides you on what to do, and if you don't do it, it ain't gonna work. So it still comes down to you 100%. You have 100% responsibility and accountability for your well-being, using the resources that are available to you. Then the last bit is time. Be patient with yourself. So have you been impatient with yourself? Have you been rushing the process? Because you might be going through depression and you feel like you're not getting anywhere. Yeah, you've seen a doctor, you've seen a counselor, you're even taking medications, you're doing all things, you're going to your church for support, you're doing everything, you're talking to your friends, but it feels like such a slow process. See, this is your life. You are the one living it. Don't let anyone rush you. So be patient with yourself. Give yourself enough time to go through the steps. Take one step at a time. I always say, the little simple steps we take every day makes the greatest impact. So don't give up on yourself. Make use of the resources around you. I hope you found this useful. I have definitely. Preparing for it has really helped me to go back on some things and just fine-tune some things, to help with my own emotional well-being. So I don't want you to keep this great information to yourself. Please do share with other people. And remember, we're doing a series on mind. We're going to share other things on, the friends of the brain. We're going to talk about hormones and how you can optimize that. We're going to talk about brain food. We're going to talk about the stress bucket and how you can cope with stress. So there's so many things coming up. So do subscribe so that you can get notification of the videos. And also, it will be a great way of supporting the great work that Fit for Purpose is doing. Thank you so much for watching. Thank you for your support. Feel free to comment, share your own experiences with me. Do put some comments there. I'll be happy to respond to them and point you in the right direction if you need professional help. Until we see you again, goodbye.